Okay. Good morning, everyone.
Good morning.
It's great to see so many of you here today. Thank you for being here. My name is Amy Shea, and I'm the President and CEO of the Health Foundation of Central Massachusetts. Our mission is to improve the health of those who live or work in Central Massachusetts. Several years ago, RCAP Solutions brought forward a proposal to address contaminated private wells across Central Massachusetts, and that's how I came to learn about inequities in drinking water protections across the state. Article 97 of the state constitution guarantees a right to clean water. Yet, unbeknownst to many, there are no minimum statewide regulations ensuring that private well water is safe to consume. In contrast, public water systems must adhere to drinking water regulations developed by MassDEP, and at a minimum, these state regulations must meet federal EPA drinking water regulations. In Massachusetts, drinking water regulations do not vary from one public water system or municipality to another, and there's good reason for that. We would not want the local boards of health in cities like Boston, Cambridge, Chelsea, Lawrence, Worcester, and Springfield to have to develop their own drinking water standards based on the resources and technical expertise available to them. Doing so would open the door to inequities across municipalities and to a potential public health crisis like what occurred in Flint, Michigan several years ago when Flint's water source was changed during a financial crisis, exposing 100,000 residents to lead contamination in the drinking water. The authority to regulate private wells currently rests with local boards of health, which are comprised of elected volunteers who have varying degrees of technical expertise about drinking water, given the many different health issues that boards of health oversee. Under this current patchwork system of local regulations, some municipalities have very strong drinking water protections, while others have outdated or even non-existent protections. Everyone should have access to safe drinking water regardless of where they live in Massachusetts. That is a sentiment shared by many across Massachusetts based on a recent MassINC Polling Group statewide poll and on homeowner and Board of Health surveys and focus groups conducted by Education Develop Corporation. You will hear more about these studies later. You will also hear from legislative champions about why they are committed to strengthening drinking water protections across the state. We are grateful for the leadership of Senator Jamie Eldridge, Representative Dan Cena, and Representative Smitty Pignatelli in filing legislation which would enable MassDEP to develop evidence-based minimum drinking water standards for private wells. Without this important step, the gap between those who have access to safe drinking water and those who do not will only grow. As MassDEP updates drinking water regulations based on ever-changing evidence about the health risks of PFAS and other contaminants, public water systems will be held to those higher standards, while those who rely on private wells will be left behind. That is an issue that is of great professional interest to me, and the Health Foundation has provided roughly $1.5 million in grant funding to RCAP Solutions for this project since 2020. This is also an issue that is of great personal interest. I spent my younger years in places like Lexington, Amherst, Boston, and Cambridge, where I had access to public water systems and never questioned whether my drinking water was safe to consume. Now, my family, which includes the 2 children pictured in this collage, relies on a private well. We are among the 500,000 Massachusetts residents who rely on private wells. Many of these residents are children who are more vulnerable to harmful contaminants because their bodies are still developing, and they also drink more water per pound of body weight compared to adults, resulting in greater exposure and greater risk. There are costs to testing and treating private wells, just as there are costs to testing and treating public water systems. In the context of routine home maintenance costs, or the cost of purchasing a home, the costs of testing and treating private wells are modest. Many homeowners can plan for these costs, just as they do for painting their homes, replacing their roofs, pumping their septic tanks, etc. At the same time, we recognize that these costs may pose a significant burden for some, so the legislation includes a provision to expand an existing state revolving loan fund so low-income homeowners can access 0% and 2% loans to remediate contaminated private wells. that Massachusetts residents may be consuming water with arsenic, E. coli, PFAS, uranium, and other contaminants is not hypothetical. It is the reality. RCAP Solutions testing of private wells across the state found that nearly 1/3 of the private wells tested had levels of contaminants exceeding state standards and/or suggesting health risks. Mass DEP's private well PFAS sampling program found that 15% of private wells tested across the state have levels of PFAS exceeding the new EPA standards. These results would be unacceptable for a public water system. But what about private wells? Massachusetts already has regulations ensuring that public water is safe to consume. The state also has regulations ensuring that septic systems meet minimum standards to protect the environment and public health. Isn't it ironic that the state regulates wastewater leaving a home, but not private well drinking water entering a home and being consumed? We can do better. We have all the pieces: legislation, data, public support, and the strong backing of organizations representing public health and medicine, environment, local government, regional planning, rural communities, and many residents across Massachusetts. Let us use the energy and momentum of today to get this over the finish line this legislative session. The longer we delay, the longer people will continue to unknowingly drink contaminated water and risk their health. Next, I'd like to turn it over to Senator Eldridge and Representative Sina for some remarks. Thank you.
So good morning, everyone, and thank you so much, Dr. Shea. And I really appreciate the collaboration between the Health Foundation of Central Mass and RCAP Solutions, and of course for MassINC Polling Group to highlight these polls that really show how much people care deeply about the quality of their water, and that actually would support a greater role for the state in regulating, including, of course, for private wells. So thanks everybody for coming. Had a chance to have a meeting with the MassINC Polling Group earlier this week and understand, what those results say. And I know we'll be hearing from the presenters a little bit later after this. But very proud to file this legislation with Representative Dan Sina, Representative Smitty Pignatelli. And, this is an issue that directly affects our districts. The district I represent has a number of rural communities. These are rural communities that, again, not only don't have any public water supply, but are really, in many ways, not aware of the amount of state investment and state regulation that happens in other communities to make sure that people are drinking clean water. So the more that people know that, and I think this poll really reflects that, the more they support that, and therefore, in my view, support the legislation. We're very hopeful that we can pass this legislation this session. Of course, the bill is before a number of different committees, and we had some really positive discussions last session around using some of the current programs of DEP to provide more support for homeowners, especially low-income homeowners, to provide support. And we also had a very impressive collaboration, again, with the Health Foundation and RCAP Solutions to do testing in private wells in some of the communities that we, Representative Sina and I, share, including the towns of Boxborough, and then a little south of me with Representative Hogan, the town of Stowe. And it really reflected that a lot of the private wells do have concerning amounts of contaminants. And so this is something that's pressing. This is something that the more people know, they recognize the need for the state to take action. And hopefully this legislation is one path forward. I think these polling results you'll hear from about shortly really reflect that. So thanks so much for attending, and I'll turn it over to Representative Sina.
Thank you. Well, good morning. Good morning, everyone, and welcome to the State House. I know there's some new faces here, but I also want to thank Senator Eldridge for his leadership, and also Representative Pignatelli. This bill is so simple and so important. I mean, we're talking about public safety. We're talking about health. I think it's so important that we get the private wells tested at least once a year to find out if there's any contaminants in there. I think it's a way for us to protect the public. As Amy Shea from the Health Foundation indicated, there's 500,000 families or individuals who will be impacted by this legislation, and that's why we all need to support it. And even if you don't use private wells, share this message, because as this is the second time, right, that we filed this bill. So we want this bill passed right away. It's not a complicated legislation, very simple. And I know next Wednesday we have a hearing, so that's also being informed that will be coming up next Wednesday. So very important that we hear from as many voices as possible. So just thank you very much, and I think I'm now turning to the polling group who will give us a presentation. Thank you.
Hi everyone. Thank you so much for being here. I'm actually filling in for my coworker Rich Parr, who couldn't make it in today because his daughter was sick with COVID. He just wants to be cautious, so he asked me to step in. With that, let's just dive in. So it looks like we had welcome and introductions. You already met Dr. Amy Shea and the other sponsors of this bill, and myself, Masha Sundaraman. My name is Masha Sundaraman. I'm a research director at the MassINC Polling Group. We conducted this survey on what Massachusetts residents think of their drinking water quality. This is based on a survey of about 1,013 Massachusetts residents. It was conducted over a week in August, available online in English and Spanish. The data was weighted to known and estimated parameters of age, gender, race, party ID, education, and geography. The confidence interval for this was about 3.4 percentage points. So when you look at the results today, they might be off by about 3.4%, give or take. That's fairly common for any survey of this kind. And you already know the people who sponsored us to do the survey. So we'll dive into the results. One of the primary findings for this survey was that nearly all residents agree that the state should have a role in ensuring safe water for everyone. And a majority of people expressed at least some concern about the safety of their drinking water. 3/4 of people supported protecting well water the same way that other water sources are currently protected, and they broadly supported the legislation enabling the DEP to do so. The survey also found what we call a testing gap. There were well water users who generally tested their water far less often than larger water systems do. Only about 1 in 5 of them had their water tested in the past year. And this was interesting because this lack of testing also coincided with a rate of people who used well water who thought their water was excellent, despite not really having the testing to back up that belief. So almost everyone we surveyed agrees that every resident should have access to safe drinking water. That includes their neighbors and other people in the Commonwealth, and they also believe that the state should have a role in ensuring this. A majority of people across demographics, across different groups, political party and race, strongly agree with this statement. So this was not a highly partisan issue. You'll see with this chart actually that 88% strongly agree that the state should have some role, and 92% total agree that everyone should have safe drinking water. The majority were also concerned about the safety of their drinking water. This is about 3/5 who believe that there could be some safety concerns. There might be something in it that they would like to have a look into. And a lot of people also thought that everyone should have safe drinking water, and that not everyone does currently in Massachusetts. That some people might not have the same access to safe drinking water as they themselves do. So what we see here is that there are people who recognize that there's a problem, whether they have another municipal water source or if they're well water drinkers, and across the board, everyone believes that there could be issues with their drinking water. When we ask this question more broadly, as in yes or no, do you believe that well water should be protected the same way other water sources should be, 73% of people said yes, they should. So not only do they recognize that there is a problem, there is broad support for there to be legislation that supports a solution to this, that supports either further testing or regulation. Now we also have a majority who support the well water legislation. 75% said they at least somewhat support well water protections. This actually increases once we add context about this bill, when we said that there could be financial assistance for people who are lower income, who might not be able to pay for water testing on their own, depending on how much it costs. It jumps up, not a lot, but still about 5 percentage points. It goes up to 80%. And there is a majority support across demographic groups. This is 83% among Democrats, 67% among Republicans, and 64% of private well users, whom you might think, this is something extra for them, right? Right now, a lot of them aren't getting their water tested, but almost 2/3 said they would actually support legislation. Oh, I'm so sorry. That they would support legislation that has them get it tested. And you can see again, Republicans, slightly smaller majority, but still a majority across the board. So not a hugely bipartisan issue. And we also found that a majority of people support some kind of testing for environmental risks and hazards. This could be radon leaks in septic systems, including testing well water if a home used the private well water system before selling it. Now, this is particularly interesting because this includes people who currently own homes that use a private well. They would be selling this home, and they also, the majority of them, agreed that it should be tested before they sell it to someone, and that a home should be tested before they buy it. So we can see that even if it's an effort, even if it's a cost, that people are actually willing to take this on. There's a slight decrease, obviously, among well owners, but a majority overall support the policy of testing homes before selling them. We also found that well water users in general didn't test their water very frequently. A majority of private well water users hadn't tested it within the past year, and about 1 in 5 didn't know when they'd last tested it, and only about 21% had it tested within the past year, past 6 months or 12 months. This quantified a major gap in testing between well water users and other water sources that state protection could help fill. Generally speaking, as Dr. Amy Shea has said, and as others have said, other water sources and water systems generally have state regulation, and so this bill could help fill regulation for people who only have private well water. Now, we also want to look at what do people actually pay for getting their water tested. Half of well water users reported they didn't pay anything for well testing or maintenance in the past year. This isn't to say that it cost them very little, it just means that they didn't get it done. Very often they paid $0. You can see in this chart, or if you look over, this was an open-ended question that we asked everyone. So we found a lot of people said, hey, it's actually covered by our HOA if they're a homeowner, or it's covered in rent. So they don't really know the cost, but the people who did pay something paid anywhere between $100 to $500 or more than $500 for their water bill or for water testing. This is important to note because there could be pushback amongst well water users to get this stuff tested, but considering that they're not paying very much right now, a small cost added onto it, or maybe even legislation that allows for financial assistance, might actually not be it might not be that hard to convince people to take that on, considering that they're not paying very much right now. We also asked people to rate their overall tap water quality. Now, residents were fairly split on whether they thought their own tap water was better than the statewide tap water. You can see a pretty normal distribution here. A lot of people fall somewhere in the middle, saying that it's good, it's passable. We do see a decent number of people saying that it's very good or excellent, but you'll also notice that they generally rate their own water better than the state's overall. And this could be for a lot of different reasons. A lot of times you ask people, do you like your school district? They say no, but they like their school. They like their personal local thing better than they think everyone else has it. But important to note too is that they do support everyone in Massachusetts having the same protections for their water as they do. So you can also see this is not a stellar report card for water quality overall. There are quite a few people who think that it's only fair or poor, and that is something that this legislation could definitely help change. Now, this is the same data, but it's broken out instead by overall respondents, by homeowners, renters, or, I'm sorry, actually, can't quite see it. No, sorry, this is not that. That's not this one. This is some similar data, but it's looking at people who have private well owners versus people who use the MWRA or municipal water system. Private well users are much more likely to rate their water quality as excellent than those who get their water from other sources. And they hold this opinion despite what we saw in previous slides, which is that they don't get it tested very often. They get it tested maybe once a year, but not even that much. So, and this is interesting because it's not just that they think their water is okay or good. 39% of private well owners believe that their water is excellent, despite the fact that they have not had it tested in they don't know how long. And this is a statistically significant finding. So we really want to hammer home that there's this testing gap, this difference between perception and reality for a lot of private well users. Now, we're looking at something similar here. What kind of water do people drink at home then? And this is broken out by homeowners, renters, and private well owners. We see that a plurality of respondents, including renters, report generally drinking bottled water at home. They don't really seem to trust their tap water. Private well users, on the other hand, actually do put their money where their mouth is. They believe their water is good, and they also, more of them, a plurality of them, drink it straight from the tap, while most homeowners drink filtered tap water. I think this chart is really important because, again, looking at renters and people who are disproportionately often younger, lower income, people of color, this is an equity issue as well. Renters don't really believe that they can trust their water. They don't have control over how often it's tested. And whether you're a private well owner or someone else, it does seem that people have a problem with their drinking water. They don't always trust it as much as they would like to. And private well owners, on the other hand, trust their water a lot, but don't necessarily have the testing to back up whether or not they should be drinking it. That's all we have for you today, but I'd like to open the floor to questions now. And actually, let me call my coworker Rich, just so he can be on the line in case you have questions I can't answer. Thank you, everyone. Give me 1 second to call him. Hey, I just gave the presentation. Can I put you on speakerphone for questions? Thank you. Yeah, hi everyone, this is Rich is on the phone right now.
Hi, Rich.
I don't know if you...
Hello, everyone.
All right.
Hello.
And the detailed results are posted on your website.
Correct, they are. They are posted on the website. Yes, I think I saw a hand.
Yeah, I was just curious, how much would water quality testing cost? Like for the homeowner or whoever sends their sample out, is there a general cost to that?
So Rich, the question was, how much would it cost a homeowner, someone who decides to start getting it tested, to get their water tested? I don't know if the survey has the answer to that. I want to say we looked at the kind of range of the cost for our particular survey. It was anywhere between, a few hundred to like a little over $500. It looks like. And was that per year, Rich?
The way that we asked that question, so first off, I would say in terms of the cost of testing, I would defer to the other folks in the room who are kind of experts in that. They might actually know an average amount. But given the way we asked that question in the survey, we asked people what they had paid to test or maintain their wells over the past year. And 53%, I think, said basically they hadn't paid anything on that front. So I want to say it's something like $200, $300 something to do a test. So compared to what those water bills that we were seeing in the survey were showing, it's a smaller amount.
Thank you, Rich. Go ahead.
So the drinking wells the boards of health have to regulate the drinking wells, right?
Right now there's a patchwork of regulation. I think towns often administer testing or ask for them to be tested, but it's not really standardized. And go ahead.
Do they have to report? does the Board of Health have to report results to the DEP now?
No.
Not currently, and I believe this is what the legislation would change, is that the way that other municipal water is tested, or maybe something by the MWRA, it's standardized, it's done much more frequently, and it is reported up. And so this legislation would basically allow an agency to do the same with private well water users. Yeah.
And local boards of health have the authority to regulate private wells. They're not mandated to regulate private wells, so not all municipalities have private well regulations. So some municipalities may have a mix of public water system users and also private wells, and those are often the ones that are least likely to have private well regulations because they're more focused on the public water system.
Right.
It's a good question, though. Yes.
I was just curious, how many people was surveyed on this survey?
Oh, it was 1,013 Massachusetts residents. Yep. Not a bad sample overall. Yeah, we had a pretty representative sample, and again, I think another point we'd like to emphasize is that this was bipartisan to an extent, and that there weren't huge gaps in support for this legislation across age, gender, or race. There's broad support for this. Go ahead.
Sorry, Mike. Rip Castro is texting me questions. So she's asking if local boards can prohibit wells in contaminated areas or where PFAS is found.
That's actually a good question, and that's beyond my scope, unfortunately.
Okay.
I think what's important to note is that the legislation itself is a piece of enabling legislation. It does not specify the details of specific contaminants, what those levels should be. All of that will be determined by DEP with technical experts and public input.
Thank you, Dr. Shea.
How often should people be testing their water? Is there like a yearly and every few months? What is like the right way to go about doing it?
So I think I don't know that answer myself, but I think right now it's more often than once a year, which is what a lot of well water users are doing. I think this part of this legislation is to bring private well water in line with other municipal systems who have it tested. I would assume at least multiple times a year, just in case. I live in Somerville. I know I get sort of alerts whenever there's a contamination or some kind of flooding or overflow in my water system, so something similar, but I don't actually know what the number would be per year. That might be something that's decided by experts or scientists, I think, once the details,
Yeah, I think Mass DEP
This is Rich again.
Oh, sorry.
I think it's safe to assume that the MWRA and the local systems are testing much more frequently. We're finding in this survey that only 21%, I believe, of the well water users said that they had tested in the past year, and 21% weren't even sure the last time that they had tested. So there's a pretty significant difference between the frequency of testing that's happening with the well water compared to what's happening in the larger water systems in the state.
Thank you, Rich.
I can jump in on that too, just saying
Oh,
that some contaminants, day-to-day RCAP Solutions, we ran the study with the 500 homeowners, and so some contaminants you want to test yearly. Mass DEP has guidelines for that testing on their website. Some contaminants would be every couple of years, 3 years, but like Rich was saying, the public water systems, some parameters are getting tested daily, monthly, and yearly.
Thank you. Anyone else? No, thank you so much, everyone, for your time. Thank you, Rich. Thanks, everyone.
All right, I need a different pair of glasses for this. Okay, let me see if I can move this forward so you can see my face twice. Here I am. Okay. So, hi everyone. As you can see, my name is Kim Dash. I'm a research scientist with Education Development Center. That's a Waltham-based global nonprofit organization. So I'm not too far away. I've been working with RCAP Solutions for about 4 years to evaluate their efforts to promote safe drinking water in Massachusetts.
Sorry, I turned it off by accident.
You did? Okay, sorry. Can you hear me okay? All right, so as part of the evaluation, I worked with RCAP Solutions to survey almost 500, so 481 to be exact, private households before and after they participated in a program offered by RCAP Solutions. So I'm going to pause here and say that's, so 500 private well owners, that's more private well owners than participated in the poll. However, the sample here is not a random sample. It's a self-selected sample, and it includes participants who hail from 12 towns in Massachusetts whose residents are primarily reliant on private wells. And the program that RCAP implemented was designed to increase access to private well water testing and screening for contaminants, as well as education on well water safety. Results from the surveys and from the water quality tests conducted in 2021 and 2022 corroborate much of what was found by the MassINC Polling Group via the statewide poll on water quality. So what we found was that the majority of households that use private well water for drinking conduct well assessment and water testing infrequently and irregularly. Of those households participating, 87% indicated that they had not had their well water tested in the past year. Only a third of households agreed that they should test well water annually. Low perceived risk and habituation, as well as perceived high costs, affect participant well assessment and water testing behaviors. The most commonly cited reason by almost 30% of respondents was, "We have lived here for a long time and no one in my household has gotten sick, so the well water must be clean." Given the latent nature of health effects associated with drinking water that contains high levels of certain contaminants, it seems that this is an area requiring more education. 68% of households surveyed have permanent well water treatment in place. Despite these precautions, results of the water tests conducted with the 481 households found, as Amy pointed out, 31% had levels of contaminants exceeding Mass DEP public drinking water health-based limits. Most commonly found contaminants included total coliform bacteria, arsenic, radon, manganese, uranium, E. coli, and nitrate. Most households are likely to make repairs when water tests reveal contaminants. That was a critical finding for us. Even contaminants at non-dangerous levels. So that's also interesting. 18% of the households we surveyed indicated that they paid for well remediation after water tests found contaminants, and another 35% indicated that they plan to implement remedies to address contaminants found in their well water. Further, if our household assessment is any indication of public support, we can say that most of the public is likely to be in favor of minimum statewide regulations with which local regulations can exceed but must meet a minimum. 52% of the households participating in the RCAP Solutions Massachusetts private well program indicated support for statewide private well regulations. And this was when we asked the question in a sort of very general terms, would you favor model regulations? We're currently conducting focus groups. To date, we've conducted focus groups with a sample of 17 homeowners and 3 local boards of health representatives. These listening sessions, or focus groups, if you will, are still ongoing, but they provide further insight into some of the findings of the MPG water quality poll. Private well owners and local boards of health representatives unanimously and enthusiastically support mandated private well water quality testing at time of property sale or transfer. They really seem to hone in on that particular element. Reasons stated include the fact that similar statewide private well regulations have been successfully implemented in other states, and its similarity to other requirements at time of property sale or transfer, such as septic system inspections. Boards of health representatives also raised the importance of ensuring that future regulations go far enough to protect renters who, as you can see from findings of the poll, already have serious doubts about the quality of their water, whether it's drawn from a private well or a public water system. And thanks for that. All right. Okay, so we have closing remarks.
Bob Duran, president of Duran and Anastas Environmental Strategies, and Jenna Day from RCAP Solutions. I'm the former chair of the Natural Resources and Ag Committee in the Senate, former MWRA chair, former secretary of Environmental Affairs, the author of the Rivers Act, the Watershed Initiative. I should have thought of this back in the 90s when I was secretary. Who could have gotten this over with back then? But we didn't. We worked on so many other important issues, including Title V, for example. And you know, it's amazing to me that we test the water, wastewater going out of our houses, Dr. Amy Shea said, and yet we don't require the testing of drinking water supplies. And you know, the issue of drinking water testing is a little confusing as well. A lot of people test drinking water for bacteria like E. coli, chlorophyll, nitrates, right? And so when they say testing drinking water, that's what most people think about, because that's what you do at closing. I'm also a real estate agent. So, you know, the bigger problem, though, isn't really the E. coli, the chlorophyll. It's the arsenic. It's the 1,4-dioxide. It's the manganese. You know, it's the radon. It's the PFAS. And I want to recognize Griffin from Representative with Speaker Pro Tem Kate Hogan's office, who's here today, and she's been a leader on those issues. We have a real problem in Massachusetts, right? So we need to do what we can. It's terrible that 60% of the respondents don't have faith in their drinking water. How do we get to that situation? When I chaired the MWRA, we required that people get an annual report. All 51 cities and towns got an annual report of what's in their drinking water. The city of Marlborough, where I live, where the senator lives, we require drinking water testing. So doesn't Springfield, Worcester, Pittsfield, those communities across the community. Who doesn't? It's the rural communities. It's the poorer communities. So this is a health equity issue as well. This affects the poor more, and it affects children more. And so we have an obligation as a society to make sure that we know what people are drinking. And you know, the other benefit here would be this. Tomorrow I'll be with the governor. She's announcing a single-use plastic bottle ban across state agencies, right? Look at the report. How many people are drinking bottled water? If they knew what was in their drinking water supply, we could reduce plastic bottled water bottles at the same time. So there's that benefit as a side benefit of this legislation. So we'll be working very hard in the building over the next few weeks to try to get this out of the Environment and Natural Resources Committee. We can't thank our sponsors enough. My good friend, Senator Jamie Eldridge and Immaculate, for your work. Representative Dan Cena, who's also a dear friend, and my good friend from the Berkshires, Smitty Pignatelli, represented by staff here today. Caroline, thank you very much. Appreciate the opportunity to speak, and we look forward to answering any questions that you might have. Thank you. Jenna?
I just want to thank everyone for coming today. I want to thank the Health Foundation for their support of this very important piece of legislation that it would not be here if not for them, if not for the 500 homeowners who let us into their homes, let us test their water, let us talk to them about remediation efforts and communicate and educate on this issue. So thank you, EDC, thank you, Bob, thank you all the staffers. I just also want to say that all the information is on our website, what'sinyourwellwater.org. So that's WHTSIN, yourwellwater.org. There is testimony there from homeowners talking about the impacts that the findings had on their health and their safety and their quality of their drinking water. There's testimony from Dr. Alan Wolf from the Boston Children's Hospital, and we are very excited to just have you all here today, and thank you for your support.
For more information about private wells, potential contaminants, why regulations are needed, and to join the Coalition for Safe Drinking Water, please visit what'sinyourwellwater.org.